Hi, everybody. My name is Mitch Bone. I am the president of the MSUB College Democrats and also a member of the Yellowstone County Central Committee or Democratic Central Committee. And today I am here with House District candidate or House District 40 candidate, Kris Spanjian.
Hello there, Mitch.
Hi, how are you?
I'm well, and you?
Good.
Great.
So I just want to start off this interview. Tell us a little bit about yourself and also tell us about your district because a lot of people don't know where the districts are here in Billings.
Yeah, that's right. Well, my district is quite a rural district. I am just to go back to my own personal history. I'm married to a native Montanan, Ray Gilbertson, though I didn't grow up here myself. We have a ranch northwest of Billings near Molt. Okay. And so my district, I'm on probably the southwest corner of my district. It extends from Buffalo Trail Road north to Broadview, over to Roundup, all the way up to Mellstone, and then east to Shepherd and along north of Billings. So it really doesn't capture much of Billings itself. It's mostly a very rural district.
That is very rural.
It is very rural, but it's these are the salt of the earth folk. It's all mostly ranching country and some wheat farming mostly.
That's great. So you mentioned a little bit about your family. Do you want to go more in depth into that?
Sure. So on our ranch, we do raise some livestock ourselves. We have a small herd of buffalo, bison, and we also lease some of our land to one of the neighbors for cattle grazing. I don't have any children, but I kind of look at my ranch and our land as my children. We have actually put it into a conservation easement with Montana Land Reliance, which means it can't be subdivided, can't be developed. It will always stay open land. I myself grew up in a family of 5 kids, lots of us. We had a family business started by my grandparents. We made athletic uniforms, sports uniforms for high schools and leagues and things like that. And as kids, we all had to work in the factory every summer ourselves just to learn about working hard and about the family business. But I ended up going into medicine. I am now retired, but I've been a physician for over 30 years. And during my training and education, I traveled here, there, lived all over the country, and ended up settling back here in the West. And I worked at St. Vincent's since 2000, mostly in the intensive care unit. So that means working with critically ill and injured patients and their families. That is one of the reasons I want to run for office.
Well, I've been in and out of the ICU and hospitals myself most of my life, so I personally want to thank you for being in that field. They really have huge hearts, and I can't thank you enough for choosing that as your life.
No, you're welcome. That was the driving force behind my practice. Connecting with people, helping them out in the worst possible time, and their families too, because honestly, I'll be working very dedicated on the health of that one patient, but the families are right there at their bedside, and they're the ones that are going through a lot of trauma themselves. So working together with a team of nurses and pharmacists and nutritionists. I mean, we have a huge team in the intensive care unit, and it's that teamwork that really pulls people through. And I miss it a little bit, with this coronavirus that's going around right now. It's a very serious thing, of course. And even though I'm retired, I volunteered to go back to work if needed. I have to say, thank heavens, our state is done wonderful things, and people have stepped up and kept this down to a minimum so far. So I haven't gone back, but I feel like I sort of feel like I should be there in one way or the other. But hopefully it won't be hitting us too hard.
Yeah, we definitely have Governor Bullock to thank for that. He has been very proactive with this, and can't thank him enough.
He has, and the people of Montana, they've stepped up too. It's amazing how many volunteers and how people have just said, hey, we'll get through this hard time. And that's what you got to do. But anyway. But the reason, Mitch, I want to go back to the reason I'm running is because I am, I am in the medical field. And last legislative session, my state representative, who is currently the incumbent and my opponent, voted against Medicaid expansion. Yep. And I know Medicaid expansion has helped a lot of people, and particularly in like my rural district, it's helped rural hospitals and rural clinics stay alive. Without it, many would have closed, and most likely Roundup Memorial would have. So it's incredibly important. He sent out a flyer that implied that if we supported Medicaid expansion, we would actually hurt the elderly, because it would take money away from the Medicare, which is the program for medical care for elderly. And that's absolutely not true. And right. That kind of frustrated me, angered me a little bit. And it made me realize that we need healthcare professionals in our legislature. And even though running for office is not something I would have thought of before, and I'm not really comfortable with some aspects of it, I figured I just had to do the right thing and step up. And that's why I'm running.
Well, I thank you for stepping up, and I agree wholeheartedly with the rural hospitals. I mean, you look at Montana, there's 5 major towns in Montana. The rest of it's rural. So a lot of places you're going 3 hours just to get care if there's not rural hospitals.
Absolutely. And Mitch, is one thing I learned a lot about when I was in the ICU is that if we didn't have those rural hospitals to take care of people when they were critically ill, before they had to be sent to us, a lot of people wouldn't make it to us, to the big hospitals. Those hospitals are very, very important. And our emergency medical techs, our EMTs and paramedics, they're also out there. We didn't have them out there. Most of them are volunteer. Their teams need to be supported too. So.
Definitely. So you've kind of touched on this a little bit, but what are some of your top priority issues that you have for your campaign?
Yeah, sorry, I kind of ran on already, but healthcare, particularly rural healthcare, is my top priority. And Medicaid expansion, keeping it healthy. Like I said, it was very important for the rural communities. Actually, particularly the rural communities, because when we started Medicaid expansion, the percentage of uninsured people in the rural communities dropped by 30%. That's pretty significant. And Medicaid expansion also, it helps out with mental health and suicide prevention programs, as well as substance abuse programs. These are all problems that are particularly high in the rural communities. So that's one of the reasons I fully support Medicaid expansion. The other experience I had as far as healthcare goes is that I was served for 12 years on the state medical board. And that gave me a great perspective about how care is delivered across the state. Because here in Billings is one thing, but again, these smaller community hospitals, you realize that you have providers out there that are by themselves or almost by themselves. They're pretty isolated, and these are very dedicated people, and they need support too.
Definitely.
And like I said, our EMTs and paramedics, most of them are volunteer. these are programs that would really be hurting without Medicaid expansion. So healthcare access is a big one. There are a few bills that I would propose besides keeping Medicaid expansion healthy. And I know it's been enacted until the year 2025, but I am afraid that there are going to be bills brought up that might weaken it in the next legislative session. So that's
I know
one
a few
thing.
from Billings that would like to loosen it.
So I would like to keep that healthy. Another bill that I would like to work on would be to limit the surprise medical billing that people sometimes get. In other words, if they have an emergency, they are life flighted into our hospital, and all of a sudden they find out later, even if they have insurance, that the ambulance service, the life flight service, or one of the doctors that took care of them is not in their provider group, and they get this completely out of network bill that's astronomical.
Right.
And that's just unfair. And I know last session there was a bill to try to address that didn't go very far, but it put a lot of the responsibility on the doctors and the doctor's office to provide them how much all this would cost. And a lot of times we don't even know that, it would have been a huge burden. I think there are other ways to approach this, but that's something I would like to work on.
That's really important, especially like you were saying with the rural places, they don't have a choice.
No, they don't. They really don't.
Yeah.
And then another bill that I would be interested in, and I've been thinking about this one for a long time when I was on the state medical board, is one that concerns education of high school students regarding CPR. Currently there is CPR that is hands-on only. It's chest compressions only. You don't have to do the breathing part. It saves lives, and it really improves outcomes. And again, in our rural areas, if somebody goes down out in the middle of the field, if you have to wait for an ambulance to get them to Billings, they're not going to do well. We need people all across, all the lay people to learn how to do this. And it's very simple. And if we had a requirement that every high school student gets the opportunity to learn this, it would be very much of an improvement. Yeah. And there are states, I know Washington State, I think Arizona also, they require that. And it has definitely improved the outcomes. So from a doctor's standpoint, that's one of those bills that I would love to see.
That's great. No, and I completely agree with that. We need to do that so that it's not such a need if somebody does, like you said, fall and end up not breathing, that they can hopefully survive. I agree with that wholeheartedly. So then give me an example of something that you've done that has maybe been controversial or has been opposed by others, and what did you do to proceed with it? Because that's probably going to happen in the legislature.
Yeah. Well, I can think of, I'll think of one that's medical related. Years ago, when it first started coming out, there was, in relation to cardiac arrest patients, there became an idea that to help the recovery of cardiac arrest patients, that you could cool them down, hypothermia, induced hypothermia, and that actually protected their brain and other organs, and they actually did better. Well, that was a pretty radical idea. And when I first learned about it, I researched it, and I tried to get that passed or put into place at our hospital. It was considered a little crazy, a little out there. But I went ahead and I wrote up a protocol, and I talked to some of the vendors that have the equipment to help you do this. And as it turned out, a patient came in that needed this treatment. And instead of me pushing it, I went to the physician whose patient it was, a cardiologist, and and then later other physicians, and said, hey, here I have a protocol already for this. And we were trialing this piece of equipment. I have it right here. What do you think? You know, and they had heard about it, but they didn't really know. And and I let him talk to the family about it. And anyway, one thing led to the other. We did institute it on the first patient, and that patient had a great outcome. So not only was it something that convinced that physician, but it also then convinced our hospital. And because it's St. Vincent's is a Catholic-based hospital, and the nuns on the board were very excited about helping people in that way. So they raised money to be able to buy the equipment for that. So that was kind of one of those things where I thought, you know, the best way to do it is to let it be somebody else's idea, as far as it turned out, get that person, that other physician, to actually buy into it once he decided, I would like to try this. So anyway, it worked out well. We were the first program in the state to put that in place. It's now standard of care. Everybody does it. But it was new and crazy at first. So that's
great.
one of the things. Yeah, it worked out well.
So what are some of your other passions that you have? You've obviously talked a lot about medical. I know you talked a little bit about your farm, and just your ranch. What are some of your other passions that you have?
Well, you know, the other issues I'm very big on is land and water issues, particularly as it relates to health too. Keeping public lands public so that all can recreate on it is very important. Not developing them and allowing cheap oil and gas leases on them, I think would be very important. We know that public lands actually are healthy because people will recreate on them, but not just from the physical aspect, but from the mental health aspect. Suicide rates go down when people actually take advantage of being outside. And the other thing is, if you have healthy land and clean water, that certainly helps the ranching community and the farming community. You want these, yes, definitely. So it helps the agricultural community and their economy. It helps our outdoor economy, which is huge in the state, tourism and outdoor industry. What is it, $7 billion annually are spent in the outdoor industry? It's huge. And then when you look at the other side of it, you know, if you have these great outdoor opportunities and keep our land healthy, you actually attract people to our other businesses. So in other words, the tech business, we need you know, people in our tech business and in our medical business and our engineering businesses that are very desirable. And if they can come live in a place that's as beautiful as our state, if we can keep it that way, it certainly is a huge draw.
Definitely.
And I've definitely noticed that in my own profession when we try to recruit other doctors. This is a big draw to move to Montana, to be able to ski, fish, hunt, whatever, bike, hike, all those things. So I think it works not only from a health standpoint, but from an economy standpoint too.
Great. So one last thing, Kris, for anybody that's interested in helping with your campaign in any way, how can they get a hold of you?
Yes, thank you. Because yes, I do need some help. I would be happy to have volunteers from any direction. I have a website that is Spanjian, Spanjian, the number 4, MTLEG, Montana Legislature.com. That's my website. I also have an email, which is the same, Spanjian for MTLeg @gmail.com. And I also have a Facebook page. So in there, all of my contact information is on my Facebook page also. and that is Kris Spanjian for HD40. So
Great. Now, I know this is kind of not the best way to make or to do a campaign, but do you have an Act Blue so that people could donate if they'd like to also?
I absolutely do have an Act Blue, and that is on my website, but it is secure.actblue.com/Spanjian, Spanjian.
Great. Well, thank you so much, Kris, for your time, and have a great rest of your day.
Thanks, Mitch. You too.
All
Take
right.
care.
You too.